Hi, friends. This week, I'm really excited to have a special guest here with me. Good health, I think, is something that we often just really take for granted until we have a health crisis. And it really just shows up right in our face that we really need to be doing something to take care of ourselves. And so I'm so happy to have Margaret Wallis-Duffy here with me today. And I'm going to have to read off all her credentials. So she is a therapist, a speaker, a consultant, a patient advocate. She is the founder of an award-winning clinic that operated in Brampton for over 30 years, Wallis for Wellness. And she is the founder of Become the CEO of Your Own Health. And now she is the driver behind Canada's first ever Preventative Health Awareness Month. Yay! And she is just all around an amazing, incredible person. I'm so proud to call friend. So Mel, welcome, Margaret. I'm so happy that you're here with me today and sharing with our listeners.
You know what, Nance? I'm so honored to be here. And, that's quite an introduction, which really isn't about that. It's about exactly having partnerships and collaborations like amazing people like you, that if it wasn't for people like you, this mission that I'm on to change the legacy of healthcare in this country from this pill for nil, wait till it's broken, to this proactive, empowered, become the CEO of your health kind of mentality wouldn't happen. So thanks for having me. The more people that can learn and grow from this movement and feel empowered so that we can live healthier and have a healthier system as a result, I'm all for it.
Yeah. Well, we're grateful that you're doing this. So tell us a little bit about how this all got started.
Yeah, so as you mentioned, I owned an award-winning integrative health clinic for over 30 years. And last spring, I took a leap of faith. When you've done something and built something from the ground up, it was a real hard decision, but I knew it was the right decision at the right time for me to move on from running a big integrative health clinic that taught me so much for 3 decades, to be able to do more legacy type work. And what do I mean by that? Work that can help to advocate for many, to help to create change and legacy in the way we look at healthcare, to really advocate for policy change so that we can feel more empowered as everyday Canadians, to have more resources in preventative health. And about 5 years ago, I took a look at the Health Canada website at their Health Promotion Day calendar. And I want to commend them for doing that. It's really important to have these days, but something stood out to me very clearly on that day. And it was this, that all of these awareness days were all about, or awareness months were all about disease. Mm-hmm. And although that's critically important, once somebody is walking through a journey and has a diagnosis, we need to support them without a doubt. And adjunctive care is critically important. Mm-hmm. However, what was so obvious to me from the lens and the arena that I've worked in for 30 years is that we need to focus on preventative health. There is this opportunity gap from, when we're well, before we get that diagnosis of sick. I'm sure you've heard this too in your practice, Nancy. The number of people that have said to me over time, Margaret, my doctor says all my results are fine, but I don't feel fine. We know when our body is whispering to us and telling us that something's not right. But in the system that we currently exist in, we wait till something is literally broken till you get that diagnosis. So to me, there was a big gap in what needed to happen. And that was preventative health awareness and education. Mm-hmm. But not just to talk about it, but to actually do something to stock the toolboxes of Canadians. So 5 years ago, I bought the URL, Become the CEO of Your Health.com and .ca, and I parked it and thought, one day I'll have time to do something with that. Yeah. Well, that time has come this fall, when I sold my clinic back in the spring, and I'm now still treating a couple of days a week and still hearing and seeing, just like we all are, the strain of our healthcare system as we walk through this global pandemic. And people are feeling really discouraged. They're not knowing where to turn. They've got a system that's strained. They can't get in to see their doctor. They're waiting for months and months to have surgeries. It's a scary time we're walking through. And the only way I try to address fear is through action. Mm-hmm. And so I thought, if not now, when? And if not me, who's going to lead this charge? And so in December, I submitted an application on the Health Canada website saying that this is who I was, what I've done for 30 years. and my vision for Preventative Health Awareness Month. And we want to kick this off, but I want this to be a yearly thing, and not just once a month, a conversation all year long, where we bring all different types of healthcare professionals together, from conventional and complementary medicine. Notice I didn't say alternative, because that's not the way I think. And to put the everyday Canadian at the center of that equation, where we stock their toolboxes with all kinds of evidence-informed strategies and all the pillars of wellness: mental, physical, emotional, spiritual, and even financial, because we know the strain that a lack of financial resources has on us and how it can make us sick. So I applied, and I then sent out an email to over 55 professionals. I was humbled, overwhelmed, and brought to tears by the number of professionals that said, "I'm in. Thank you for doing this." But what got even more exciting was when I got the call and spoke to a representative from Health Canada who said, "We think this is an amazing idea. Thank you for taking the charge." And they are recognizing it. So February 2023, just days away. We are having our inaugural Preventative Health Awareness Month. And thanks to people like you, it's going to happen. Now, I must admit, I'm kind of breathing and saying, okay, progress over perfection. This is not going to be perfect the first time around, but it doesn't have to be. As you know, as the saying goes, a job started is a job half done. We've got work to do, but the people behind this mission, doctors and surgeons and naturopaths and massage therapists and physios and coaches and tapping experts and fascial stretch therapists and dietitians and organizations are saying, we're here. We want to build resources better together as one. And that's the philosophy we're going to move forward with.
I love it. I love how you're just giving people, you say you're helping to stock their toolboxes. A lot of times people just don't know where to turn or what to do, even if they wanted to, start doing a bit better for themselves in terms of their health, even if they haven't hit a health crisis yet, but they don't know what's out there. And so this is so amazing, because now they're getting exposed to all of these different, modalities, opportunities, and we're all going to learn from each other at this summit. It's at this during this campaign. It's just going to be wonderful. So tell us a little bit about what you have in store.
Yeah, and thanks for recognizing that, because I know that there's a plethora of information online, but it can be a scary place. You can go down a rabbit hole, and who do you trust? And you want to make sure, I want to empower people to have the confidence to advocate for themselves and to create their own team. And I want to say this before I say what we have in store. The mission also behind this is to make people shift their mindset to recognize they are the most important member of their healthcare team. And by having a go-to resource like Preventative Health Awareness Month and the ambassadors, which I'm calling them, of healthcare professionals and other resources there at their fingertips that they can trust, they can feel more confident to have a voice, to speak to their healthcare professionals, and to get into action when it comes to their health. So how this is going to work initially, and I know it's already starting to morph as we get going, and so I'm excited to just be on the journey with everyone else to see where this takes us. But I want all players at the table. So not only do we have healthcare professionals, I've engaged government. I'm trying to get Preventative Health Awareness Month declared at municipal levels to say that this is a month that we're going to recognize as an important campaign. And then we're going to chunk up the month. So in February, we're going to break it down. How do you bite an elephant? One chunk at a time. And I think sometimes people can get overwhelmed, and that analysis paralysis stops them from doing anything. So each week is going to have a different theme. And we've kind of looked at some of the pillars of wellness. One of the consistent things throughout the entire month is going to be stress and mindset and anxiety, because it's so prevalent and it's so critical to change behavior. So we're going to have that. There's going to be a week all about food as medicine. Yeah, you heard it. Food as a prescription. We even have a doctor who's reached out and wants to be involved, where he looks at food as a prescription. So really important. Fueling our bodies and our minds is critically important. We're going to have a week all about movement and mobility and pain, and how motion is lotion, and how do we handle that aspect of our health. We're going to have an entire week about sleep and relaxation and calming the nervous system. And then we're going to have different focus days, and those keep growing. where we're going to talk about certain topics that I keep hearing as a professional that are so important. Everything from looking at the aging population and how do we help people age well, looking at men's health. Men deserve to have support as well. They see the way they approach health maybe differently than women, and I don't think there's enough focus on that. Menopause, so many women struggling with not enough resources. Mental health in our youth. Suicide, and looking at suicide both from a preventative perspective and a support to those families that are left behind to grieve the loss of a loved one who's died by suicide. Nancy, what else have I forgotten in terms of days?
Did we talk about pregnancy, menopause? There were so many. I know it's hard to remember them all.
And bone health is another one.
Yeah.
And throughout the month, we're going to have different webinars, and the content that's going to be online through Facebook, Instagram, and TikTok, which we're building. So you've got to go and follow CEO of Your Health on all the social platforms. I'm really excited in our partnership with Go Local Virtual Events. They have allowed us to customize this super innovative and cool interactive virtual venue that makes it so easy to provide virtual workshops and webinars, but in a really cool environment where you can pull up a chair or sit in a Muskoka chair in like a park atmosphere.
Yeah.
We're all zoomed out. Zoom has served us well, but we want to have more real interactions. So we have this virtual preventative health awareness hub that all month long you're going to be able to come into and talk to professionals and have meetings and see webinars. And if you missed a webinar, they'll be recorded and you can go into our hub and watch it in a TV room when you have time. Yeah. So we're trying to make this accessible to all ages and stages of life, on your time, on demand. And this really is just to start and ignite a conversation of change that we're going to see happen. I want us all to look back 10 years from now and say, how cool is that?
Yeah.
Started something then, and look where we are now, because that's my goal, is that we together are going to leave a legacy behind for our kids and future grandchildren that is different than what exists today. And the timing has never been more important.
100% agree. Fantastic. Now let's just do one more thing. Let's make sure we let people know. I know you said to follow CEO of Your Health. So maybe what we'll do is put a link below this video to the Facebook page and the Twitter page. Instagram page and the TikTok. We'll put links to all of those so that people know how they can participate, because you are not going to want to miss this. This is going to be fantastic. So,
and also, I'm just frantically working behind the scenes with some great people. The website is becometheceoofyourhealth.com. So stuff will be on there. So if you're and sign up, that's a big call to action. Please sign up on becometheceoofyourhealth.com. It's not live yet, but it will be by February 1st. Okay. Because join our community, join this movement. So when we move forward through the month of February and beyond, if anything is happening in your community, if we're hosting an educational webinar or event, if you're on that list, you will be notified. So we will come to you, so you don't have to worry about finding us. So please share. And the biggest thing is tell everybody, share this. I want engagement, because we're going to have certain hashtags and we're going to track this, and I'm going to write a report to send to Health Canada at the end of all of this to show just how important not only this campaign is, but how Canadians need this, how we must work towards change, and we are going to be part of the solution, not the cause that's straining our healthcare system at this point in time.
Wonderful. So it's becoming the CEO of your own health.
No, become the CEO of your health.com. Become the CEO of your health.com.
All right. Become the CEO of your health.com. It'll be a link in the notes. All right. Thanks so much, Mark. It was great chatting with you, and I'm so excited for everything that you have put together, and to meet all of these amazing people that are coming together to learn from each other and from anybody who's participating, because everybody has something to give, right?
Yes, and a shout out to you. You are going to be contributing content, very valuable content. So in the hub, you're going to be able to see that there's this wall of ambassadors. Everybody, every professional that's contributing will have their picture there and a link to where you can find them. So you can start to stock your toolbox and to build your team of professionals that you can trust so that you can get into the driver's seat of your health. And I couldn't do it without people like you. So thank you, Nance.
Excellent. All right. Well, we will see you all in February on Become the CEO of Your Health.com. All right. Take care.
Bye.